Welcome back to Melisia Talks, where we talk all things uniquely you for the month of May. Well, you know what? Before I even get into what this month's topic is, can you believe we are already here? Like 4 months have already gone by so fast. And like I said in my previous podcast, April was extremely busy for me, but the month flew by like we had just literally, you know, started April 1 just a couple of weeks before. So it is going by so fast. And so, with that being said, here we are, the month of May, and we are celebrating nurses. That's right. This is Nurses Month, with our week specifically being May 6th through the 12th. And so I wanted to just come on every week and shout out our nurses, but specifically looking at the nurse practitioner role. Yes, in some capacity, I have been a nurse for 22 years, almost 23 years. So I am so grateful for that opportunity to be able to be a blessing to others, for others to be a blessing to me, to have great mentors in this field, and still being able to do what I have been called to do. And so, with that, I am Melisia Robinson, and I am a nurse practitioner with my certification in adult gerontology primary care. And so, what does that mean? Pretty much that I deal with patients from the primary care standpoint who are considered adults. And so, and even our older population with gerontology. And when we talk about adults in this aspect, it is from the age of 13 up, although we think of those 13 to 18-year-olds as being children still, but that still falls under adult gerontology, primary care work. And so, with that being said, we are highly skilled healthcare providers, and we play a very integral role in delivering comprehensive patient-centered care. And so overall, we look to blend advanced nursing expertise with medical knowledge to diagnose, treat, and manage a wide range of health conditions. And so just understanding that nurses as practitioners, we can do a lot of different things, but we have to always practice under our scope of practice, just like any other area of nursing, whether it's starting out with your certified nursing assistant. Those they too have to follow a scope of practice, along with those who might be a licensed practical nurse or even eventually a registered nurse, and even, of course, nurse practitioners, which are advanced practice registered nurses. Overall, we all have to follow a scope of practice, meaning that we should not practice outside of our scope, right? And so, overall, primary care nurse practitioners, again, which is where I fall with my certification, we can work in outpatient settings. These could be family practices, community health clinics, urgent care centers, hospitals. So, overall, your responsibilities can vary by state and with the various laws that are governing our nurse practitioners and our practice authority. And so many of us can have, in some states, full practice authority, meaning that we are allowed to work independently without a physician's oversight. And so, but other states may not allow that full practice authority, so they may have to have that physician oversight. Although, when we say oversight, does not mean micromanaging, but having someone there to be the person to sign off on whatever that nurse practitioner will look to do. But again, some states do allow for that full practice authority. And so when it comes to some of the main responsibilities that our primary care nurse practitioners can do, we can look to manage even your acute and chronic illnesses, which can include assessments of the various symptoms when you present, ordering your diagnostic tests, also developing various treatment plans for conditions that we see so often here in our society, and that could be hypertension, diabetes mellitus, various respiratory infections, and even our chronic respiratory issues, COPD, asthma, you name it. Primary care providers are there to be able to provide that as your nurse practitioner. And so When it comes to prescribing medications, we have that full prescriptive authority to be able to prescribe medications, and that also includes controlled substances such as your narcotics. And many of our practitioners that look to prescribe those narcotics will have their DEA licensed as well. And that just means Drug Enforcement Administration. And so making sure, of course, that if you're going to prescribe any of those controlled substances, that nurse practitioner must have that DEA license. All right, so what's some other things that we can look to do when it comes to your routine checkups, preventative care, which is what we are really pushing now, especially in primary care. And that is just looking at your usual physical exams. That can be your annual wellness exams, various screening recommendations, whether that be for elderly clients or men as it relates to prostate cancer screenings, your usual for women breast cancer screenings, and just overall ensuring that we are doing all that we can as it relates to health and wellness and promoting that health and wellness in our clients. It also could look like immunizations. We know that our little ones, of course, have our immunization schedules, but we also have our older clients who, over the age of 65, we have on our vaccine schedule to have your pneumococcal, which is, of course, for pneumonia. So always keeping that in mind. Overall, when it comes to patient education and counseling, this is a great part of the nurse's role overall, not just for nurse practitioners, but for the nurse who is practicing at the bedside or practicing, of course, in another capacity. That education is key. And so it involves guiding that patient on various lifestyle changes, being, compliant to their medications and that disease prevention as well. But it is just taken up a notch when it comes to the nurse practitioner because you are now more involved with being the one that's probably prescribing that medication and also ensuring that they are, again, being compliant while taking those medications. And so when it comes to the aspect of working with others, we know that you have that physician that's there and you're collaborating with them as well. Also being mindful of any specialists because we do have the ability to look to refer you to various specialists to be able to handle something that's not considered primary care. So let's say that provider and nurse practitioner notices that there's something with your gastrointestinal system, your stomach area, let's just put it that way, which we know other aspects of the body is incorporated the GI system. But just let's say there's an issue going on with your stomach that's beyond primary care. Well, we can refer you to a gastroenterologist, that GI provider, right? Or we can refer you to someone who is, let's say, if there's a heart issue, let's refer you to the cardiologist. And we know even in all of those specialties, we have nurse practitioners working, right? So again, from the primary care standpoint, we would be the ones to refer you to those specialists, also working, of course, with any case managers, social workers, and anyone else that is involved in this patient's care holistically, right? And so overall, keeping that in mind and remembering when it comes to your health promotion aspect, and I'm going to do a talk, one of these series on social determinants of health. It is so key that when we think about other groups of persons who might not have the same access to things that we have, that we are also keeping that in mind. We, and depending on who's listening, we may not be the person who may live in an area that has, a food desert, right? We may not live in an area that lacks health care or access to health care. And so being mindful of that health promotion aspect, even looking at those unfortunate social determinants of health that many of our clients and those that we might see are dealing with. And so when we talk about those things and being an advocate for those clients, we're looking to address those social needs and even being mindful of health policy changes. Many nurse practitioners are, for lack of a better word, boots on the ground, and we are there in, of course, the White House, there, of course, in your state capital, lobbying, trying to push policies, trying to push change from this aspect as it relates to health care and even nursing practice. And so with that, again, I just want to keep in mind and let everybody know nurse practitioners can do so much. And so if you're one of those people who say, oh, I want to see the doctor, take a moment just to see and try, because we know the doctor, physician may be busy, schedules may be out further. Try the nurse practitioner. I promise you, you won't be disappointed or let down. So, last few things here I do want to look at, and just making sure people understand the differences between that physician and, of course, the nurse practitioner. Although they may have more authority, the nurse practitioner has just as much authority. When you look at it, we pretty much can do everything that that provider can do, especially if we are in a state, like I said, that is given full practice authority independently from the provider. We can have our own, practices, our own facilities as well to be able to practice. And so there's not much of a difference, other than, of course, if it's specialized, and of course the fact of the amount of schooling. But when we talk about schooling and the years that you were in school, for me, I do have a doctorate in nursing practice as well. And so when you incorporate that with the amount of time spent in my undergraduate, and then also couple that with the years spent for my master's, and then for my years spent with my doctorate, that's about 8.5 years. And so we have been in school for a while. We have, of course, gotten the knowledge, gotten the training, and we can, of course, practice just like, but obviously in different capacities as it relates to that physician. And so we often focus on the holistic aspect of that client, the preventative health, while sometimes you may see the doctors or that physician looking at more so of the disease management and the advanced medical treatments. And so, again, not that we aren't doing that as well, but we also bring in that holistic care. And that is meeting every aspect of that client, not just treating the issue, but also meeting the need from a spiritual aspect, meeting the need from a mental aspect. And so all of those things holistically is what we look to do when we are treating our clients. And so I mentioned already as it relates to, the various settings that we can be seen in, but we also can do telehealth. I do want to bring that out. Many nurse practitioners work from the telehealth aspect. If you're not able to get in to see that provider, if they have the opportunity for you to be seen via telehealth, do it. If your insurance covers it, you have the ability to do it, go ahead and move forward with that. Also, I did mention, of course, the certifications and education. Many of us as practitioners can be, certified by different, those two main certifying bodies. That is, of course, the American Association of Nurse Practitioners, AANP, and then also ANC, American Nurses Credentialing Center. And so we have a choice when we get ready to be certified and take that certification exam with which company we decide to go with. And so with that being said, we do have to recertify every 5 years and make sure that we are up to date with the latest information and that we are practicing. And so just keeping that in mind, we keep those certifications up and we stay, in tune with what's happening by way of making sure we stay certified in our time frame that's necessary. And so when we, of course, receive our license, we also receive our certification in some capacity. A Master's of Science in Nursing is what you would need to be able to have that certification and become a nurse practitioner, and take that exam, of course, with whichever credentialing body you decide to go with. And then, of course, if you decide to go for your doctorate of nursing practice, it can be in different avenues. Like mine is in clinical leadership. And of course, we could also have some, nurses to get their PhD as well. So it really just depends on what you decide. But when it comes to that primary care nurse practitioner, you're going to get that MSN first, get certified from whichever credentialing body you decide to go with, and then, of course, lead on to, if you decide to do your doctorate of nursing practice, you can do that, or again, get your PhD. So overall, primary care nurse practitioners look to serve and bridge that gap between, preventative care and specialized treatment. Overall, just looking to ensure that that patient receives the personalized attention that they deserve when they are there in the clinical setting. And so, as I said, this month I want to ensure that I am highlighting other health topics that are very critical. If you remember and listen back in February, I had an amazing provider on, Dr. Trapp, who gave some information on cardiovascular issues and things of the sort. And so I want to dive deeper into some other disorders that we can see pretty often, some chronic disease management and how nurse practitioners can look to manage that. Even being mindful, as I said, of those social determinants of health. And then also maybe looking at some autoimmune disorders. Although I am not the actual expert in them, we all have the potential to see clients in the primary care area that present with some of these things. And although we are, again, moving them or sending them on to someone who's a specialist, they still are going to be in our care as that primary care provider. So just looking at some things, being mindful of what that can look like. So stay on the journey here with me. I am so excited to be just celebrating nursing and nurses this month. And so stay tuned. We have a good show this month. All right. So this is Melisia Talks, where we talk all things uniquely you. Until next time, bye.